Hi guys, welcome to my second video. Today I am going to tell about the accreditation. So first we should know what is the accreditation, then we can proceed for the accreditation of the healthcare. Thing is that what you mean by the accreditation. Accreditation is nothing, it is a formal review of a organization who is providing the services on the basis of their quality standards, which is pre-established by the certified body. So accreditation is a formal process where some third party people will come by the accreditation body, will be organized way, and they will do the inspection, they will verify the documents, they will verify the organization, they will match the performance of the organization as per the standard. If you are eligible or you are performing best as per the quality standard, then the organization will get the accreditation mark. So it is providing the accreditation is not only a certification or a accreditation is providing the benchmark to the organization that they are accredited by a certain governing bodies and they are meeting the quality standard. Certification then, accreditation and certification, is it same? No, certification and accreditation are different entities. Certification is the part of accreditation, but accreditation is not equal to certification. Certification is like formal confirmation of any object or or any person or any organization, like we are seeing the food products ISO certified, or any shops like ISO certified, like. But accreditation is like where the certification will conform with the process of accreditation. Accreditation is will validate the competency of the organization, where the certification will validate the give the individual or product wise certification. Accreditation will provide the confidence in the certification process, but it won't equal to the certification. Certification is a part of accreditation. So in India and in world, we have lot of accreditation bodies in the healthcare. In healthcare, if we'll see the accreditation bodies like Joint Commission, which is giving the JCI accreditation, Joint Commission International Accreditations. Most of the hospital in India also has been accredited by the JCI. NABH is the governing body of the Quality Council of India, where NABH is an Indian accreditation. So in India, most of the hospitals are having the and are going for the NABH accreditation and having the NABH accreditations. And apart from NABH, we have the Accreditation Commission for Healthcare, that is ACHC, and Accreditation Associate for the Ambulatory Care. For the Global Health Accreditation also we have, and the NABL. NABL is only for the lab. This is also is the India best accreditation. It is only for the testing labs and the testing laboratories. So here we'll see the type of accreditation program. Type of accreditation may hospital accreditation. Hospitals are being accredited by the JCI, NABH, where we have the some program specific also. Program specific accreditation also is there, where the specialized services like the blood banks will be accredited, then the lab, then the imaging like radiology centers, then eye care facilities, then home care facilities, dental clinics, allopathy clinic, ayurvedic clinics, panchakarma clinic. These are all will be get accredited in the program specific accreditation. And we have the small healthcare, where the small healthcare organizations, which is less than 50 bedded hospitals, will be recognized as a small healthcare organization. For them also NABH is providing the accreditation. And digital health, for the HIS and EMR system and the hospital digitalized systems, we have the digital standard NABH digital health accreditation. And some niche certifications are there, which is for the nursing excellence, emergency department, entry level certification, and the stroke excellence. So the accreditations are like, for the hospitals the accreditation will be different, for the small healthcare hospital accreditation will be different, the digital health facilities it will be different, and the some certification, accreditation and certification, already I have told these are the different entity. And program specific accreditation also is available. How to get the NABH accreditation? We'll see. NABH accreditation. NABH is a national accreditation board for hospital and healthcare providers. Whoever is providing the healthcare services, mainly NABH for the allopathy clinic. For Ayurvedic and for the homeopathy and Panchakarma clinic also, the NABH is providing the accreditation, but that certifications are different from the hospital and healthcare provider accreditations. So NABH accreditation is having the entry level accreditation and full hospital accreditation. So for the entry level accreditation to get, more than 50 bedded should be there, and hospital should function minimum 6 months. There should be 30% bed occupancy. Any new hospital should function IP operational bed minimum 6 months. So minimum 6 month data they have to produce to the NABH during the application of the NABH. So, and the 30% bed occupancy is mandatory to apply for the NABH accreditation in the entry level and full NABH accreditation. Both it is the mandatory. But for the small healthcare organization also, the hospital should function 6 months. Minimum 30% bed occupancy is required, but the hospital bed strength is sanctioned bed to be 50 bed. I am talking about the sanction bed. Sanction bed should be the 50 bed, and for the full and entry level also, sanction bed should be more than 50 bed. Your operational bed, maybe your sanction bed is 200, you are operating 100 bed, it is fine to go. But your sanction bed is not more than 50 bed, and you are applying for the full NABH, then it will get rejected. It won't come. It will come under the small healthcare organization standard only. So now the NABH accreditation, we are in the 6th edition of the NABH accreditation. Already 5 editions has gone. 6th edition is recently released in the month of December 2025. And small healthcare organization standard is having the 3rd edition, where whichever the hospital want to go for the SHCO, the 3rd edition SHCO standard they have to follow. And full NABH accreditation, they have to follow the 6th edition NABH standard. Gradual next videos and all, I'll tell about the 6th edition NABH and the small edition, 3rd edition of the SHCO also. What it is, how many standards, how many objective elements, and how many your chapters are available in each of the accreditations requirements. What is the accreditation process? How we need to get accredited? The accreditation process is very simple. First, the thing is that first the hospital should meet the minimum requirement of the NABH. Then they can do the self-assessment and their document preparation, which is available on the NABH website. In the NABH website, you will get the self-assessment toolkit. Along with that, what and all document required to upload during the application process. Like chapter wise documents are required to upload in the NABH applications. My next video I will do the requirement of the documents for the application process. I'll upload soon. In that you will come to know what and all document is required for the NABH application and how you have to gather the document. So once your all documents are ready, then you can open the NABH website where you can do the login, and you can have your official mail ID with your with one contact number where you will do the login and you will upload the required document. Then you have to pay the application fee. Once your application fee will be paid, then your application is being submitted. Once application will be submitted, before your desktop review you have to pay the annual fee. One fees you have to pay. So that once you pay the annual fees, then your desktop review will be done by the allotted assessors and the principal assessors, and they will give you some non-compliances where you have to re-upload the document to get the clearance for the desktop review. Once your desktop review will be finished, then one date will be allotted to you for the on-site assessment. Virtual assessment was applicable during the COVID time, but now there is no virtual assessment, only the on-site assessments are applicable. So on-site assessment date will be provided for the hospitals as per the bed strength. If you are having the bed strength within 100, then your assessment days will be 2 days. If more than 100, then it will be 3 days. If it is 4 to 500 days, like it is a main days is there in the NABH website, how many days for how many beds is required and how many assessors will come. Minimum one principal assessor, one assessor is mandatory to come. And once you will get the date, then you have to talk to the assessors about their arrivals, their bookings, everything. Then once your on-site assessment will be done, then you will get a certain non-compliances which you have to upload in the website after compliance, for which you will get only 60 days time to upload for the accreditation and re-accreditation. But surveillance assessment you will get only 30 days of time to upload your NC documents. So surveillance is what? Surveillance is that you are maintaining the accreditation or you are not maintaining the accreditation properly. You are maintaining the standard and not, the NABH will do a check. So surveillance assessment will conduct every 2 years for the hospital, for the full accredited NABH hospitals. Once the accreditation process will be completed, your NCs will be approved by the principal assessors, then your hospital's license documents will be checked by the ethical committee, and once it will be cleared by the ethical committee, then your accreditation committee will give you the accreditation certificate. So once the hospital will get the accreditation, then every 2 years they have to go for the surveillance. So what is the validity of the accreditation? Validity is for the entry level NABH 2 years. Every 2 years you have to go for the accreditation. Once the entry level it will be done, then you have to go for the full hospital NABH accreditation only. Entry level will be given for the only first time. Then full hospital NABH is 4 years. Then every 2 years surveillance will be there. Then SHCO, small healthcare organization, is for 3 years. Digital health, it is for 4 years validity, and any nursing certification, stroke certifications, it is for the 2 years validity. Thank you so much. So if you like the video on the accreditation, please like, share and comment, and subscribe the channel. If you want more informative videos on quality in healthcare, then kindly comment the topic. I will create the video. Thank you so much.